So I'll be happy to discuss with you today about the antibiotic-responsive enteropathy with the question of does it exist? As before, these opinions are expressed by myself and are not representative of others. I don't have any other disclosure that are going to influence this discussion. So let's start with chronic enteropathy. And typically, we've got what happens is clinical signs for more than 3 weeks, and we've got a multifactorial disease. So this is a schematic from Stater and al. That kind of shows these multiple features of the disease that we need to take into account, and that's the same in our pets than it is in people. So there is a genetic susceptibility, and that has been well described, for example, in German Shepherd dog. We have an immune response that typically is overzealous, so there is an inflammation and it continues. It doesn't go damp, it's not dampened anymore. We've got environmental triggers, and we've got obviously the microbiome that's going to interact with our gut. Now, dogs and cats are different in the sense that they don't have the same type of inflammation in the gut. The treatment is going to be a bit different as well, in the sense that typically we wouldn't need surgery in our patient, which is something that would be that can be different in people. So the outcome for people can be different as well. But we do have this multifactorial aspect of the disease that definitely is in both, in all species. So this is the reverse pyramid that we often use to discuss animals with chronic enteropathy. And we know we've got a lot of data now that tells us that food responsive is mostly what we see. So these dogs, cats that have been worked up where we don't have any extra GI disease, we are dealing with chronic intestinal disease, we are going to have a high majority that are going to be food responsive enteropathy. And then we tend to use antibiotics as a next stage, and that was a bit a few years ago, and that shows how old I'm getting. We were using antibiotics as the next stage in many of these cases, so antibiotic-responsive enteropathy. Now, if we were reaching the last part, which was to use steroids, typically that's at this stage that we would be doing biopsies to figure out if there is some other changes in the gut that would make us more worried, or looking for a lymphoma in the gut, some diffuse disease or other type of pathology. But we're going to concentrate on the antibiotic responsive enteropathy, and the question here is going to be about what the evidence do we have for the antibiotics, what is the efficacy, and are there any negatives of using them? So let's start to go to Melbourne, where I did my PhD with Professor Mansfield. This is a picture of Flinders Street in Melbourne, an iconic building there. And the study that I was part of was looking at dogs with chronic enteropathy. So at inclusion, we had 19 cases that underwent an endoscopy and then a diet trial. Now, the endoscopy, as I was mentioning before, is not something that we would normally do in these cases at the start, but we will do it if we're going to use steroids. So, but for the principle of the study, we needed to have that at the start. So these dogs went into a diet trial. If they didn't respond, then they went to oxytetracycline. That was the antibiotic that was chosen for this particular study. If there was no response, then we started them on immunosuppressive drugs. So a very typical pattern of this reverse pyramid that I showed you before. And then what we did is we followed these dogs for 5 weeks, and we wanted to have a remission for 5 weeks. And we also followed them long term. So this is a breakdown when we were at 5 weeks. We had 10 dogs that were food responsive, 7 dogs that were antibiotic responsive, and then we had 2 dogs that needed immunosuppressive drugs to be controlled. What we did in this study as well is follow them really long term, and we were lucky to be able to do that with a median of more than 21 months of follow-up. And that's how the picture looks like at that point. So as you can see, the dogs that were food responsive are still very food responsive. So 8 of them are still completely in remission, 2 are partial remission, but actually the signs are not bothering the owners enough to do more than just leave it. The antibiotics is a very different picture. We did indeed have 2 dogs that went into remission, but 4 dogs are in partial remission and 1 relapses and was never really controlled. The 2 dogs with immunosuppressive drugs were in remission. However, we had to use a low dose of prednisolone to keep them in remission, but they were long-term control from the point of view of the clinical signs. Now, this doesn't really speak well for the antibiotic-responsive enteropathy in a sense that it's not a cure really, and it's not something that we are going to be able to use for a long-term treatment. What bothered me even more in that study is that 4 out of these 7 dogs were still requiring ongoing antibiotic treatment. Now, it might have been pulse treatment, but it was still antibiotic that were coming into the dog system really often after the study. And so this is obviously not the best, especially if we think about long-term management of this patient. Now, what do these antibiotic-responsive enteropathy dogs look like? And they've been described. They've got nice studies that show the characteristic of these dogs, and typically they have no or partial response to diet. The antibiotics that have been used include tyrosine, metronidazole, and oxytetracycline would be the main ones that have been used. It's typically young dogs and large breed dogs. The German Shepherd dogs are overrepresented in many of these studies. They can have small or large intestinal disease. Many of these dogs will have vomiting as well, and their appetite can be variable from increased appetite to really reduced. So that's not a typical feature of one or the other for these dogs. Now, a lot of these studies were done in Sweden, and Dr. Kilpinen has done really nice work on tyrosine, and they have named this disease tyrosine responsive diarrhea because of these dogs responding to tyrosine. And this is a nice study where they did a placebo-controlled, randomized, double-blinded prospective clinical trial. So kind of the Rolls-Royce of the research. And what they did is they took dogs that had frequent relapse of chronic enteropathy where they were responding to tyrosine. So they included dogs that had tyrosine within a month of being included and that had responded to the treatment. So they were suspected to be tyrosine responsive. And then they followed up the dogs for 2 months. What they saw is within these 2 months, 27 dogs relapsed, so 44% of the dogs they were following. Then they randomized the dogs into tyrosine group, that was 20 dogs, and then placebo, dogs that were not given tyrosine but a placebo instead. As you can see, most of the dogs that were treated with tyrosine did respond. 85% got better. Whereas in the placebo group, only 29% got better, so 2 dogs out of 7. Then some of these dogs went into a tyrosine treatment after not responding to placebo, and the overall response was 20 of 24 dogs did respond to tyrosine. So that's a great number. However, we need to keep in mind that all of these dogs were actually treated with tyrosine within a couple of months beforehand and still needed another treatment. And this recurrence is there. And this is really something that's important for us to consider, because if we think about a One Health approach in antibiotic resistance, veterinary medicine, most of the antibiotics that are being used in agriculture. However, the dogs and cats that we treated are part of these animals that could be potentially a potential antibiotic resistant. Sorry about that. And so most of our pets obviously are not going to be eaten by the people, but they're going to be in close contact, and it can potentially contaminate people if they have developed antibiotic-resistant bacteria because of us using these antibiotics. So the reason they might develop resistant is because we use a drug which is ineffective. We might use inappropriate drug, and we can question if we have to repeat treatment every couple of months. Are we doing the right thing, or we are underdosing? As I was mentioning, most of these are going to be from agriculture, but still we have a close contact between our pets and people. They're also going to go outside. They're going to contaminate the environment, the water, the soil. So this is another way where people might be in contact with this resistant bacteria. After that, we can have transmission into the hospital, into the community, and there is really a big cycle of potentially very nasty bacteria that are going to go throughout. So this is really something that we need to keep in mind. If we look at a study from Tang et al., what they did is they look if the reduction of antibiotic use in food-producing animal reduce the presence of antibiotic-resistant bacteria. Now, in Europe, this is banned. In other countries, this can still be used, but that was the query here, and typically it's used in agriculture to increase the yield. So what they did is they looked at Campylobacter in feces. They looked at many others, but I just looked at the data for the Campylobacter in the feces. And most of these animals are treated with macrolides. And what you can see here is that animals that were pre-treated or had antibiotics compared to animals that were not treated, the animals that were not treated had about 50% less resistance against macrolide with a confidence interval of 26 to 4% to 26%. And so this kind of shows nicely that the use of these antibiotics in our animals can lead to resistances. Another study that I think is important in this discussion is from Watkins and al. And what they basically have shown is that there was an outbreak of Campylobacter jejuni infection that were really resistant. And what they did is this and this is a map of the US and the patient that they had. They actually were able to show that this patient at all had contact with pet store puppies. So there was really a link here between the animal and the patient. And that's something that we need to keep in mind with our animals. Now, what do we know about antibiotic and dysbiosis? Now, Jana has done a very nice talk discussing the different changes that we can see, and I just want to reiterate that and look at what we see in healthy dogs and also in dogs that have chronic enteropathy. So this is a study from Igarashi et al. And we've got two types of dogs that were treated. So they were all healthy dogs, but they were either treated with metronidazole, that's the left-hand side, or with prednisolone on the right-hand side. And you've got the different days that they were treated for. So they were treated for 14 days. On the left-hand side, we've got the richness, so on the y-axis, the richness of the bacteria. And what we can see is that when we are giving antibiotics, so that will be after 2 weeks of antibiotics, we have really a drop in this richness compared to day 0, which was in red. So there is really a significant decrease, and then the animals after 28 and 42 days are going back to where they were. So we can see that we are reducing the richness of our microbiota. In comparison, prednisolone given for 14 days didn't really make any change in the dysbiosis, in the richness of our species. Now, that doesn't mean that we should be giving prednisolone, but it's just to show what are the differences in some of the drugs that we are using. So that was in healthy dogs. Now, in the next study, this is again in healthy dogs, and that was mentioned by Jan as well, but I want to show you because it's so striking. These are dogs that are given metronidazole for 14 days. We've got the dysbiosis index on the y-axis and the time on the x-axis. So all of these dogs are healthy dogs with relatively normal dysbiosis index. We start antibiotics, and at 7 and 40 days, you can see this shift, which is significant. Now, when we stop the antibiotics, we have a normalization, but you can see that some of these dogs are very abnormal still 42 days into the study, which is about a month after stopping the antibiotic. So some of these animals that are healthy to start with really struggle to go back. They also looked at the metabolite in the feces, so not only the bacteria that we have, but only what they're producing. And these are the dogs at the start that are all gathered in this pinkish circle. After 14 days, you can see them having a very different metabolite profile than they had to start with, and then they're going to start to shift back to where they were with time. But again, some of these dogs are not very different from what they were to start with, and so it's not only the bacteria, but it's also what they're producing that is going to be changed with using antibiotics. Let's go now to tyrosine. These were studies that were done with metronidazole, and now this is a study from Manchester and al. Where they did look at tyrosine over time. So they wanted to look at it for a bit longer, and we've got very similar results than we had with metronidazole. So this is the dysbiosis index on the y-axis and the timeline on the x-axis. The dogs were relatively normal were normal to start with. Then we've got the dogs that are given tyrosine. These are the diamond, and you can see how dysbiotic they become. That's at day 7 when they finish the course of antibiotic. Still very abnormal in some of these dogs after 21 days, so 2 weeks later. At 63 days, so about 2 months later, we still have some dogs that are very abnormal. And we can look at that as well from a point of view of what these bacteria are producing. And this is a graph representing the primary bile acids in this patient. So as Jan mentioned before, we are expecting to have a low amount of primary bile acids in normal animals. And what we see, again, the diamonds are the dogs that are given tyrosine. You can see how these dogs start to have much more primary bile acids than they had to start with. And that continues even 2 weeks after they were treated with antibiotics and 2 months. So it's not only the bacteria, but it's also what they are producing that's being abnormal in these healthy dogs, and that can last for a really long time. Finally, this is a study from Botero et al., and this was done in dogs with chronic enteropathy. So all the previous studies were done in dogs that were healthy, and now we are dealing with dogs with chronic enteropathy. We're looking at a Shannon index that gives us an indication of how diverse this population is. And then we've got dogs that were given antibiotics, and dogs that were not given antibiotics, and they had the same treatment as the wild. But what you can see is that when they are given antibiotics, we do have a marked reduction in the richness. So again, the same as we see in our patient, in our healthy dogs, we see the same as well in patients that have chronic enteropathy. So we are adding, it's like we're adding a second hit when we are using antibiotics in our patient. Now, so if I summarize what I've just mentioned, that's a bit where we are. That's a hashtag that has nicely been put by Dr. Salavati, who kindly let me use this picture. And as you can see, this is something that we remind our students very often, because we see so many of these cases coming with metronidazole for chronic enteropathy. So that's kind of a reminder in our treatment room that really we should try to avoid that. So does antibiotic-responsive enteropathy exist? Because that was the question we had to start with. And the answer would be yes, but no. Yes, because we do have dogs that are going to respond to antibiotics, but it is a boomerang. It's going to come back, and they're going to be sick again with the same signs as they had to start with. As I mentioned to you, there is this risk of resistance, and really we cannot ignore that if we are using antibiotics in this patient. Now, this is a sketch of what we see. The brown would be the dogs that have chronic enteropathy that are food responsive. The blue would be the antibiotic responsive, and the gray would be the steroid responsive. As I mentioned before, most of them are going to respond to food. But if we were to say, well, if they don't respond to food, we're going to give them antibiotics, you could see all the gray, which are the immunosuppressive dogs, would be given antibiotics when they actually don't need it. So we would be treating a lot of dogs with something that they don't need. And as I mentioned before, then we've got this dysbiosis in these cases that are being treated with antibiotics. So really, these are all reasons to say, not really, we shouldn't do that. So when should we use antibiotics? And there is this paper in JSAB from Secretary et al. That looked into that. And basically, the bottom line of that is we should really rarely use antibiotics. If we have an underlying proven infection, such as granulomatous colitis, and I will discuss that a bit later, then yes, we should treat them with antibiotics, and that's what they need. If we've got a systemic inflammatory response syndrome, So if we've got animals that are neutropenic, that are pyrexic, going into shock, then yes, we would need to use antibiotics. If we know that there's an acute infection with an enteric bacteria pathogen, that's not self-limiting, but that's not really something that we see so often in our cases of chronic enteropathy. But this would be kind of the cases where we should think about it. If we have other presentation, really we should think about other ways of treating. So now I want to give you an example of a case where we do need antibiotic. This is a boxer, 7 months old, that we scoped very recently, and we are now in a colon. And you can see that this colon is really thickened, and you can see that there are this ulceration as well in different parts of the mucosa. So the mucosa is abnormal, the mucosa is thickened, there are ulceration. This is a boxer, 7 months old. This is the type of dogs where we are really thinking about an infectious process happening in the gut. So what is granulomatous colitis? So we see that in young boxer and French bulldogs, and typically we need biopsy to confirm the diagnosis. There is a granulomatous inflammation. We've got an uptake of periodic acid shift or staining with PAS by the macrophages, so that's very typical. We can also use fluorescence in situ hybridization to show that there are bacteria and that they are invading the mucosa. And what happens in this patient is that they have a genetic defect and they're actually not able to clear these bacteria that are in their wall. Now, these animals are really beautifully responsive to antibiotic, which is the great news, but they also are tending to develop resistances, either because they've been treated before with antibiotics or they might already have one. And for this reason, we tend to culture as well the wall to know what we're dealing with. And in some cases, we find other bacteria actually that are being the reason for the clinical signs. But this is definitely an antibiotic responsive and they need antibiotic. Now, I would like to show you a few slides that are from Dr. Montanez Sancho, one of our residents that was presented at the Feline Congress. And this is some cases that we've seen in Edinburgh. This is 7 cats, but there are some of these cats that are from other countries. And these cats presented with a neutrophilic and ulcerative bacterial enteritis. They use as a NUB as an acronym for these cases. Now, these are cases that have severe GI disease and that had extensive workup for infectious disease to make sure that there is not an infectious process that is the reason for these cats to have these signs. When they typically have very thickened wall on ultrasound, and this is an histology of a full thickness, and you can see how thickened the wall is. We've got a lot of inflammation going on there. We've got loss of the epithelium. And if we look at the histology of these cases, we had the neutrophilic enteritis in 7 cases, ulcerative enteritis in 4 of 7, and it was pyogranulomatous in 3. However, they were all PAS negative. So I mentioned to you before with granulomatous colitis that we see in boxer, they PAS positive, but these ones are not. And this is how it looks like. So the small inset is from Simpson et al. And this is a healthy dog. You can see the epithelium and you can see the blue round cells. So that's the nuclei of the cells, a very nice normal epithelium. Then we've got the mucus, which is black, and we see bacteria that are over the mucus, and this is something that would be expected to be normal. This is one of these cats, and we don't have any epithelium, it's just gone. And we've got these red dots, which are the bacteria. You can see them starting to go deep and deep and deeper into the tissue. So there is really an invasion of the tissue. There's a disruption of the epithelium there. So there's several things going on there. Now, these cats ended up being treated with a lot of different treatment. Most of them were on a hydrolyzed diet. They all went on antibiotics with a histology when we had this finding because we were really worried about an infectious process within the wall. And some of these cats had at later stages prednisolone at anti-inflammatory dose, and a few had FMTs as well, fecal microbiota transplant. Probiotics were used as well in some cases. Now, the start was good. We had an initial response to antibiotics in most of these cases within a week, which is what we see in boxer. However, this was not sustained and most of them relapsed And most of them were euthanized because they were actually not responding anymore to any treatment, with a survival time of 6.5 months in the cats that were euthanized. 2 cats had no relapse. 1 had a relapse but was able to be cured after a second set of antibiotics. Now, this is a very small proportion of cats that I'm telling you about, but they are there. They are there, and we're trying to understand them because obviously we're not there yet into the treatment. We know that antibiotics most likely are required for these cases, but we need to know more to that, and we need to understand this disease better. So basically, if we are doing biopsies and we get more of a pyogranulomatous neutrophilic inflammation, that's when our radar for potential infection needs to go up. So what are the alternatives to the antibiotics? So I've just been talking to you for a long time saying I don't think we should use antibiotics, but what else could we do? So one of the things we can do is use supportive care. And that could be for this animal that has a bit of vomiting, a bit of inappetence, and we can actually, give them an antiemetic, give them some appetite stimulant and make them go through this little bout of being a bit unwell. And then we've got fibers that's been discussed. We've got pre and probiotic. This is something that's been looked at as well. And I will speak a bit about the fecal microbiota transplant because this is something that we are really, I would say, really pretty excited, to be honest. And it's something that we're really looking into more right now. So pre and probiotic. So the prebiotic is basically the nutrient that we're going to give for the good bugs that we have in the GI tract. The probiotic, we give the bugs themselves. So that's kind of the idea of what we're doing. And the fiber is a bit of a mix because the fiber does have some prebiotic effect. They can be helpful for short-chain fatty acid production. They're going to alter the gut microbiome to some extent. They're also going to have some regulation of the metabolism. It's definitely going to have a big effect on the fecal feature. And if you had animals that were given psyllium, the owners would most likely be able to tell you about that. And it's going to also affect how the GI is regulating its motility. So it does have a lot of different effects, not only the prebiotic, but all these other effects. Now, all this, what I'm talking about, we are actually missing evidence, and we have limited evidence for fiber. Most studies have been done in large intestinal disease, but there's a lot of questions. We don't know which type is the best one, the amount, and there's going to be another talk which will be really interesting to see a bit more about the options there. But these are questions that we need to have. There are some dogs and cats that really respond really nicely to fiber, so it has to play a role in a subset of the patient, but I don't know that we are the best yet at finding out which one are these patients. However, one of the big things of it's safe and well tolerated. As long as they have enough water so that they don't get obstipation, they're going to tolerate that well. I had one owner that lost their mind because of the amount of feces that the dog was doing on the psyllium that I was giving. We just reduced the amount and it was fine. But so, it's really safe, which is good. One of the good things with fiber is that it might enable us to reduce the amount of drugs that we're using or to potentially taper the medical treatment. If we go in pre and probiotic, it's the same thing. We've got limited evidence there, but there is here, I've put 2 studies, one from Dandrieux and one from Rossi, where they use different mix. So Dandrieux used Saccharomyces boulardii, and it was a mix in the one from Rossi. The first one was a prospective, non-randomized, double-blinded placebo control. And all of the animals had concurrent treatment with diet, antibiotic, and immunosuppressant. So it was the big cocktail there. But what we had was the dogs that were given this cocktail plus the Saccharomyces had improved clinical signs. They all responded, but they had a bit of a better improvement there. The one from Rossi et al. Was to compare the use of metronidazole and prednisolone versus using only the probiotic. And both groups responded, which is great, right? If we can use probiotics instead of anything else, who wouldn't want to do that? And there was a significant improvement in both, but it was lower with the probiotics, which is not that horrible, right? We're talking about 5 versus 10 days, but both groups did respond, which is really great news. Now, one of the issues with pre-probiotic is that we have some conflicting evidence. Some studies we've got a good response, some we don't. And we have a lot of options, and there was a question before about which one to use, and we don't really know. There's different bacterial strains, a different amount. And we've got very different studies. Some start with a certain type of dogs. Some have different endpoints than others, which makes all comparison really difficult. However, it's overall safe, like the fibers. And in my views, if that's to give something to the owners to make them happy, rather than give antibiotics, give prebiotic. It's safe, and it actually might work, and it's less antibiotic that are being used. Now, finally, I want to tell you a bit more about fecal microbiota transplant. There's going to be other talks talking about it, so I don't want to go into too many details. But really what we're trying to do here is to transplant the healthy microbiota of dogs and cats to an animal that's got acute or chronic enteropathy. So you've got here Lauren and Nuno that are doing a fecal microbiota transplantation in one of our patients. What's important is that to have the poo hat. If you have the poo hat, usually it works better in our hands, but that's how it works, right? We've got an animal and we are giving microbiota. It can be given orally or rectally. We tend to do ours rectally currently, but we're looking into oral. But there is, again, limited data. We don't know which one is the best donor. We don't know which one is the best recipient. We don't know how often do we need to donate. And these are all questions that are going to be very exciting to answer over the next coming years, hopefully. So can we bypass the antibiotics? So that's the same pyramid as before, but instead of having antibiotics, let's put here microbiota modifying responsive enteropathy. And that could be any of what I've been telling you about. So what I want to show you is the next study that we did after the one I've shown you is we decided to go away from the antibiotics. We didn't have a long-term response. We didn't reach what we wanted. So we decided to go endoscopy and food trial. That doesn't change. And then instead of an antibiotic, we use FMT. So fecal microbiota transplant. And if there is no response, we go for immunosuppression. So what we got in this study, we had a total of 22 cases. Again, as the previous study, we had most of these dogs that were food responsive. And then we have 6 dogs that were responsive to an FMT. So with FMT, they improved. And then we had 3 dogs that required steroids. Now, this is an outcome of 5 weeks, and we are missing here the long-term follow-up. But we were able to reach in the short term the same as we did before with antibiotics by using microbiota transplants. And I think this is really interesting in a sense of that might be really where we need to go and go away from the antibiotics and see what happens long term. I want to show you a last study from Torres and et al. This was briefly mentioned before, but it's a retrospective study of 41 dogs with chronic enteropathy where they used FMT as an adjunctive therapy. So their dogs were on a lot of different treatment. But we've got 26 responders. We've got 5 that had a short-term response, and we had no response of 10. But still, 26 dogs that didn't respond did respond after having FMT. And 16 of these had more than one FMT. What's really important and very nicely showed here, you've got the dysbiosis index between the good response and the poor response. The dogs that had a poor response had more dysbiosis. And that goes with what Jan was mentioning before. We have to think about healing of the epithelium. We have to think about all the different parts of the GI tract. So, in conclusion, some animals respond to antibiotics, but mostly short term. And this is the reality of Dr. Salavati. She's usually that smiley. So I wanted to give her credit on how she is and how it's nice to be working with her. Use of antibiotic is a cause of dysbiosis. It is a risk for development of antibiotic resistance. So really that should make us think about using them. Granulomatous neutrophilic inflammation, we have to think about possible infection and we have to look for it. Alternative to antibiotics, there are many, but we really have little information yet, and we need more research. There is new evidence for microtransplant, but we are still wondering about the donor, the route, the best protocol, and we have a consortium right now looking into that. So please watch this space because I think there is some exciting data that will be there soon. And with that, I would like to thank you, Purina Institute, to be able to talk to you today. Melbourne, where I did part of the studies, Prof. Mansfield and Dr. Martinez, the University of Edinburgh, where I am, and you've got some of my founders as well on these slides, and obviously all the dogs and cats and their owners that enabled me to talk to you today.